Welcome to today's Audiology quiz. In this session, we will go through some key questions about electrocochleography, or ECochG. Let's get started. Question 1. Which of the following is the correct set of components in ECochG? The correct answer is B. ECochG consists of three key components: cochlear microphonic, summating potential, and action potential. Now let's briefly go over why the other choices are incorrect. A is incorrect because ABR is not a component of ECochG. Instead, ABR is a separate auditory test. C is incorrect because otoacoustic emissions, OAE, are also not part of ECochG. They measure outer hair cell function. D is incorrect because Wave I, Wave III, and Wave V are components of ABR, not ECochG. Question 2. The action potential in ECochG corresponds to which wave of the ABR? The correct answer is A. The action potential in ECochG corresponds to Wave I of the ABR, which reflects activity from the auditory nerve. B and C are incorrect because Waves 3 and 5 originate from higher brainstem structures, not the auditory nerve. D is incorrect because Wave 7 is not typically used in ABR interpretation. Question 3. How can ECochG be used to differentiate between Cochlear Microphonic and ABR Wave I? The correct answer is A. Reversing the stimulus polarity helps distinguish cochlear microphonic from neural responses, because cochlear microphonic follows the phase of the stimulus and cancels out when alternating polarity is used. Question 4. In the ECochG graph below, what do the labeled points A and B indicate? Point A represents the summating potential, and point B represents the action potential. The summating potential is generated by hair cells in the cochlea, while the action potential corresponds to the response of the auditory nerve. Question 5. Based on the ECochG graph below, what is the SP to AP ratio for this patient? Step 1. Identify the given values. The summating potential, also known as SP, has an amplitude of 0.8 microvolts. The action potential, also known as AP, has an amplitude of 1.6 microvolts. Step 2. Understand the formula. The SP to AP ratio is calculated using this formula, SP divided by AP. Substituting the given values, we get 0.8 divided by 1.6. Step 3. Perform the division. To simplify, think of both numbers as whole numbers, 8 divided by 16. 8 divided by 16 equals 0.5. Step 4. Interpret the result. A normal SP to AP ratio is usually 0.4 or lower. If the ratio is higher than 0.4, it suggests endolymphatic hydrops, which is commonly associated with Meniere's disease. Since this patient's ratio is 0.5, it is higher than normal and may indicate Meniere's disease. So, the correct answer is 0.5. Since this is greater than 0.4, this patient's ECochG results suggest the possibility of Meniere's disease. That's the end of today's ECochG quiz. How many did you get right? Let me know in the comments. If you found this helpful, don't forget to like, subscribe, and stay tuned for more audiology quizzes.